Assalamualaikum warahmatullahi wabarakatuh to Dr. Dzulkarnain and my fellow friends. Today, we will present about prevention and management of musculoskeletal injuries on ankle.
Assalamualaikum and hello to our honorable lecturer, Dr. Ahmad Dzulkarnain Ismail. My name is Norakmala Fika Zafira binti Jamaluddin and I am from RSR 24548. These are my group members, Ekwan Hakim bin Muhammad Nawawi, Muhammad Ati Iqlil bin Muhammad Yusri and Siti Sarah Nafisa binti Syamsul Azhar.
Hi and Assalamualaikum. My name is Hakim Nawawi. I'm from RSR 24548 and my mental number is 2021513513 and 521. So today I will explain about anatomy of ankle sprain and another one anatomy of tendons. For the first one, anatomy of ankle sprain occurs when the strong ligament that support the ankle stretch beyond their limits and tear. Ankle sprain are common injury that occur among people of all age. They range from mild to severe, depending upon how much damage there is to the ligament. Ligaments are strong, fibrous tissue that connect bones to other bones. The ligament in the ankle to help and to keep the bones in proper position and stabilize the joint. Most sprained ankle occurs in the lateral ligament on the outside of the ankle. Sprain can range from tiny tears in the fiber that make up the ligament to complete tears through the tissue. If there is a complete tear in the ligament, the ankle may become unstable and you cannot walk properly. So, ankle sprain have three grades. For the first one, grade 1, sprain, mild, slight stretching and microscopic tearing of the ligament fibers. There can be swelling around the ankle. Grade 2, moderate, partial tearing of the ligament and it can be also swelling around the ankle. And for the last one is severe complete tear of a ligament, signification, tenderness and swelling around the ankle, so you cannot walk properly. Next is tendon. So what is tendon? A tendon is a band of tissue that connect a muscle to a bone. They have two peroneal tendons in the foot run side by side behind the outer ankle bone. One peroneal tendon attached to the outer part of the midfoot, and another one run under the foot and attached near the inside of the arch. So what the function of peroneal tendons? Peroneal tendons is to stabilize the foot and ankle and protect them from the sprain. And now to diagnose a peroneal tendon injury, the doctor will examine the foot and look for pain, instability, swelling, warmth, weakness on the outer side of the ankle. In addition, an X-ray or other advanced imaging study may be needed to fully evaluate the injury. I will tell you guys about major tendons in ankle. For the first one is Achilles tendons, which attach the calf muscle and the calcaneus. Next, flexor hallucis longus, which run along the side width of the ankle and attach to the big toe. Third, flexor digitorum, which run along the inside of the ankle and attach to the other toes. Peroneal tendons, a set of three tendons which run along the outer of the ankle and attach the fifth metatarsal and the bottom of the foot. Six, posterior tibialis tendon, what attach the midfoot and help to maintain the foot arch. And the last one is anterior tibialis tendon, which run down front of the leg and attached to the bone of the midfoot.
Ankle sprains are common injuries that occur among people of all ages and activities level. In fact, they are the number one reason for missed participation in athlete. An ankle sprain occurs when the strong ligament that support the ankle stretch beyond their limits and tear. The severity of a sprain can vary greatly depending on the number of ligaments involved and the extent to which the ligaments are torn. Most sprains heal with conservative treatments like ice, elevation, over-the-counter medication, and simple rehabilitation exercise. However, if your ankle remains swollen or painful for several weeks despite conservative treatments, or if you have difficulty putting weight on your ankle, you may need to evaluate to ensure that you do not have to severe ankle sprain or fracture. If symptoms do not improve despite on treatment, you may need surgery to repair or construct the injured ligament. Without proper treatment and rehabilitation, chronic or untreated severe sprain can weaken your ankle, making it more likely that you will injure again. Repeated ankle sprain can lead to long-term problems, including chronic ankle sprains and instability. Lateral ankle sprain occurs the ligament on the outside of the ankle are stretched beyond their limits. Injury to this ligament causes pain and swelling in the ankle. Generally, most lateral ligament ankle sprain are minor and will get better with simple treatments. However, more severe cases can weaken the ankle, leading to repeated sprains and chronic ankle pain. A lateral ankle sprain occurs when the ankle rolls inwards to twist. Generally, your ankle twists during many activities such as walking, running, or even surfaces. Playing sport involving change of direction or unexpected fail. Almost all ankle sprains can be treated without surgery. Even complete ligament tears get better with treatment such as bracing and physiotherapy. Overall, just because you tear your ligament doesn't mean you need surgery. Achilles tendonitis is an overused injury of the Achilles tendon, the band of tissue that connects calf muscle at the back of lower leg, your heel bone. Achilles tendonitis most commonly occurs in runners who have suddenly increased the intensity or duration of their runs. It's also common in middle-aged people who play sports such as tennis or basketball only on the weekends. Most cases of Achilles tendonitis can be treated with relatively simple at-home care under your doctor's supervision. Self-care strategies are usually necessary to prevent recurring episodes. Most serious cases of Achilles tendonitis can lead to tendon tear that may require surgical repair. Plantar fasciitis is one of the most common cases of heel pain. It involves inflammation of thick band of tissue that runs across the bottom of each foot and connects the heel bone to the toes. Plantar fasciitis common cause stabbing pain that usually occurs with your first steps in the morning. As you get up and move, the pain normally decreases, but it might be returned after a long period of standing or when you stand up after sitting. The cause of plantar fasciitis is poorly understood. It is more common in runners and in people who are overweight. Most people who have plantar fasciitis recover in several months with conservative treatment such as icing the painful area, such stretching, and modifying or avoiding activities that cause pain.
Hi, Assalamualaikum. My name is Siti Sarah Nafisa binti Syamsul Azhar and I'm from RSR 24548. My metric number is 2021-513743. There's a few do's and don'ts when applying kinesiology tape. The thing you should do for applying the tape: first, before applying the tape, you need to clean the skin with hand sanitizer or rubbing with alcohol. Make sure that the area is oil-free, dry, and removed from any lotion. Second, if you are using a kinesiology tape roll, you need to round every corner when cutting the tape so that the edge will not peel prematurely due to rubbing on clothing or other materials. Since the tape is made with an acrylic adhesive that is heat activate, you can activate it by rubbing the tape from the center toward the ends of each strip. You can use your bare hand for this, or you can rubbing the tape using the baking paper that you tear from the kinesiology tape. Remember, do not rub from the ends toward the center. For your information, kinesiology tape is water resistant, so you do not have to worry about getting your tape wet. You can shower, bath, or even swim while wearing the tape. After activities that cause the tape to get wet, you can dry it by gently patting the tape down with a towel. Best to allow the tape to dry for at least 20 until 30 minutes before doing any other activities. Some reminder: do not use a hairdryer to dry the kinesiology tape, as this may cause the adhesive to melt. Should the tape start to peel or roll back, you can trim to loose side with a pair of scissors. Lastly, if there is any thick hair on the area you wish to tape, it is best to trim the hair about 1/8 inches so as not to interfere with the tape's ability to stick to the skin. Next, you should avoid using kinesiology tape if you applying the tape immediately after exercising or showering. Also, do not applying the kinesiology tape to broken or damaged skin and any skin irritation occurs. If you have sensitive skin and it is your first time using kinesiology tape, perform a 24-hour skin test by first only applying a small patch of tape to the area you would like to treat. Make sure avoid touching the adhesive side of the tape when you remove the baking paper. In addition, be careful to not overstretch the tape during application and avoid stretching the ends of the tape. Never rip off the tape like it's an ordinary plaster because it's going to be painful this way. Always remember to take your time when removing the kinesiology tape from your skin. That's all from me. Thank you.
In this slide, I will tell you 3 types of tapes. The first step is strapping. Strapping or non-elastic athletic tape is commonly used white cloth tape that most athletes use to tap a body part prior to a sports activity. Sports strapping tape is used to provide support to joints and reduce pain and swelling, improving physical activity and allowing athletes to optimize their performance without compromising on safety. Dependent on the athlete's needs, different types of sport tape should be used. Second type of tapes is kinesiology tape. Physical therapists sometimes use kinesiology taping as one part of an overall treatment plan for people who've been injured. The American Physical Therapy Association reports that kinesiology taping is most effective when it's used in conjunction with other treatments like manual therapy. Kinesiology tape is also used to add extra support to muscles or joints that need it. If you have patellofemoral stress syndrome, IT band friction syndrome, or Achilles tendinitis, kinesiology tapping might help you. Last but not least, underwrap. Underwrap is primarily used to protect your skin from the potential irritation of wearing adhesive tapes, for example, zinc oxide or EAB, or other names is elastic adhesive bandage. Acting as a thin barrier, underwrap is applied before overlaying with strapping tape. So the first tapping is for Achilles tendinitis using kinesiology tape. The first step is start with place one tap at the heel toward the calf while pointing the foot upwards. Foot in relaxed 90-degree position. The next step is apply the base of Y tap just above the heel and adhere towels covering the cuff as shown while maintaining the foot bent upwards. For additional support, wrap around the ankle with another one tap. Remember, no stretch is applied during the application. That's all for HLS tendonitis using kinesiology tape.
So this is a technique for a sprained medial ankle. First, I will elevation the ankle slightly to measure the length. Use kinesio tape. I measure using kinesio tape starting from medial side of an ankle and other end to the middle side of the knee. So next, I will apply one end of long tape at the middle side of the ankle and another end to the middle side of the knee. I will use 0% tension for this step. And lastly, anchor another short tape on the inside of the ankle and apply the end of the strip as shown. Put 75 until 100% tension in the middle of the knee. This is so important to lock your ankle.
Okay, now I want to show how to tapping and the lateral ankle sprain. This is the kinesio tape and this the area of the lateral ankle. First, take a kinesiology tape and place at the lateral ankle to the bottom of the foot. Put the kinesiology tape at 25% of stretch and then rub the surface to activate the SSA. Next, place the kinesiology tape at the middle of the lateral ankle. Okay, next, place the kinesiology tape at the lateral ankle and stretch for 35%. And that's how you do it.
Next, I will show you how to do a kinesiology tap for plantar fasciitis. First, measure the distance from the back of your heel to the ball of your foot, and then cut the tap into long strip. After that, round the edges of your strips, and then measure the length of the ball of your foot. Lay each strip down over your arch. Gently rub the tape using paper or your hands. Next step is place the second piece of tape on the ball of your foot to secure the strip. Make sure you secure the tape by gently rubbing with your hand. That's all for kinesiology tab for plantar fasciitis.
Now it's my turn to explain about the procedure of ankle sprain taping. You can apply under wrap on the foot and the lower 1/3 shin until the ankle is covered. Apply 2 ankle strips at the end and topmost part of the pre-wrap. Add a basic stirrup strips with start the first strip from the outside of the ankle and go under the heel and up to the inside of the ankle and repeat 2 until 4 times. Support the stirrup strip with adding a horizontal strip around the ankle. Start the first strip from the lateral, which is outside of the ankle, and cover half of the ankle strip. Take the tape behind the Achilles tendons to the inner foot. Tear off and attach to cover half of the ankle strip on the ankle's medial side, which is inside of the ankle, and repeat 3 to 4 times until you cover both ankle bone. Proceed with first heel lock, which is with a figure of 6 locks to support the ankle joint. Start the first heel lock on the top of the foot. Take the tape under the foot to the outside of the foot and cross the lateral side, which is outside of the heel, at a 45 degrees angle. Go around the Achilles tendons, passing through the medial malleolus, which is inside of the ankle bone, and go around the lower leg again. Tear off the tape and secure to the lateral, which is outside of the leg. Support the first heel lock with second heel lock with the same procedures and with a cover strip. Next, put the figure of 8 lock for extra security. Start on the outside of the leg, cross over the instep on top of the foot and go under the foot. Come out from the outside of the leg again, cross the top of the foot and attach to the inside of the leg. It will look like an X on top of the ankle. Secure the taping with cover strip, which is similar to ankle strip, to lock all the tapes at the top and bottom of the tapes. Lastly, make sure to cover any hole with tapes.
Okay, now I want to show you how to strapping the Achilles tendon. First, apply one strap of tape around the upper cuff. This is for the ankle. Next, place another strap of tape around the mid-foot. Then, attach the tape from the foot anchor to the calf anchor. Agak sikit. And lastly, apply another tape at the mid of calf for the anchor to keep it secure. Okay, and that's how toe strapping at the Achilles tendon.
These are the references that we use for our presentation. That's all from me. Thank you. Have a nice day.